Bipolar 1 or bipolar 2 looks like me and looks like you, except when they have periods of normal functioning, and then they have periods where they have an episode, and when you refer to the suicide part, the depression is so bad that they are at high risk for suicide, very high risk. And I've had a number of cases where, unfortunately, with a combination of drugs, people take their lives, and it causes devastation for everybody else. With the bipolar type 2, also they are like you and me, and they just experience fluctuating moods.
Therapy helps a lot with helping people to accept the condition and get to grips with it. Unfortunately, in some cases, therapists, if they are ignorant, and some of them are, may try and think that they can talk people through the condition and get them to help to cope just with therapy, which is not possible. Unfortunately, bipolar mood disorder needs both. It does function a lot better. People do function a lot better when they have therapy and medication, but the therapy alone won't do it. Basically, so getting to grips with the diagnosis is a major part, and also where therapy, especially cognitive behavior therapy, can be very valuable is in terms of helping people to weigh up the pros versus the cons of medication, because non-compliance is a huge problem and it causes relapse in episodes.
Psychological support is a huge part of getting better and managing your symptoms, and understanding that you're not alone, and feeling that there are people out there who get you, feeling like you belong. That's massive. Instead of walking through this world alone. It's just too sad. We're not meant to be alone. I think that it potentially isolates you because you're different.
My brother's supportive, but he still thinks that you take a pill and your illness goes away. It's not the case. Take medication to maintain your lifestyle.
Part of the treatment is look at your lifestyle. Have a look at what the triggers or the stressors are, and learn to manage those. And there's support groups for all of that to help patients cope.
Like in the suburb around us, all the people go to work, and it's not as though we have a social life there. So this is a social life for us. We're mixing with people, and they are, and for the most part, they're nice people. Nobody is sort of nasty to you or anything like that. And it's nice to have that environmental situation where you do see others.
Isolation, it becomes social. People don't feel alone, I think, and it doesn't matter what illness you've got if you're sitting at home. I've got an article that I'm going to write this evening for the newspaper to put in for this month, and just how serious isolation can be. And they reckon that people actually die earlier if they're isolated, So this is why, as you can see, a lot of them sit outside. There's a lot of laughter and they chat, and it depends. The committee sometimes, some people in the committee thinks that we should be working here or producing, but I think it's what people want,
When you're diagnosed with a condition like bipolar mood disorder, you usually don't know anyone else with that condition. There probably are quite a few people around you that you don't guess are living with the disorder, but until you go to a support group, you tend to think of yourself as being the one and only person. So it overcomes that feeling of being very different and very separate from the rest of the population, and the loneliness that goes with that. The other major use of being with a support group is that it gives you a lot of psychoeducation.
No, I enjoy coming here because, as I say, I can chat with people who have not the same illness as me, but have mental disabilities. And I also enjoy, like for instance, I've been selling cards since last year. I started selling Christmas cards, and then now already this week I got a nice order for 200 Christmas cards.
There's almost a lot of shame around, and humiliation, and not good enough, and one-downness, because what people do not understand, they put a judgment on.
When people have had this kind of disorder, you really have to take stock of yourself and adjust to a new vision of who you are, and often that goes with feelings of inadequacy. And then also relationships are affected. Inevitably, if there's a couple relationship involved, there'll be a lot of strain, and also the family relationships change. So sometimes therapy is not just individual, but you may have couples therapy and also family therapy.
But as long as we have an understanding, and our family support group has an understanding of what is happening, we can work with it. But very often, with miseducation, with a lack of awareness, with mixed messages that we get depending on what culture we come from, because culturally there could be a lot of ideas and myths that circulate, and that's a different topic. But the judgment that other people put onto people who've been diagnosed with mental instability or disorders is because it makes them feel, makes the person who's doing the judgment, makes them feel uncomfortable in a way, and so they tend to remove themselves or ridicule them or make fun of them. So can you imagine how hard and heartbreaking and rejecting that is for people who are judged by others?